Hi, Mr. Smith. I took a look at your vital signs today and noticed that you're a bit hypertensive and have a body mass index that correlates as being overweight.
I know I'm a bit overweight, but I have hypertension as well. Will I need medications for that, or what can we do to treat this?
Well, you're only a bit hypertensive. Given that you're also overweight, I believe that the two may be correlated and that we can try out some other interventions prior to going straight to medications.
Okay, well, what did you have in mind?
Well, exercise has been shown to both decrease blood pressure and to help lose weight. Do you currently exercise?
I used to, but it is so hard now, especially since I work during the day, and by the time I get home, I'm super tired, hungry, and I have to take my dog to the backyard to play.
I can understand how it may be difficult to exercise after a full day's work. However, given the medical benefits and your vital signs indicating hypertension and being overweight, are you interested in beginning to exercise again or beginning some sort of exercise program?
Well, would that help with my hypertension? And also, how great of a risk is my hypertension?
So let me start by addressing your second question. Hypertension is a risk factor for numerous other conditions, including coronary artery disease, which is when the vessels in your heart get occluded, which can lead
Okay.
to heart attacks. It's also a risk factor for strokes, atherosclerosis, which is the narrowing of your vessels, and other cardiovascular issues. The best case scenario would be to address the hypertension early in order to avoid the increased risks of those other conditions.
Hmm. Okay.
And then, with regards to your first question, I do believe that implementing an exercise routine into your lifestyle would not only help you with your hypertension, but would also
Hmm.
help to bring your weight down a bit. Would you be interested in learning more about exercise and implementing it into your lifestyle?
I guess I would be okay if you really think it'll be helpful. It's just tough.
Well, tell me more about that. Why do you say it's tough?
Well, like I said, I work throughout the day, and when I get off, I go straight home because I do have to take my dog outside to play.
Okay, so it sounds like it's pretty important for you to get right home and take your dog out. Is there a way that we can get you to exercise and take your dog out simultaneously, or bring those two together?
Do you think something like running with him?
Well, perhaps. I mean, it doesn't have to be anything super strenuous to begin with. Even just, doing intermittent jogging and walking with your dog would help.
What do you mean by that?
Well, since you're just starting up with exercise, we don't want to push you too hard because it can lead to injury. But maybe, you can take your dog on a walk, right? And while walking, you can switch between, 3 minutes of walking followed by 1 minute of running and go back and forth between walking and running.
Okay. Do you think that will help?
I think any exercise would be a great starting point. What do you think?
I think that's something I could do. But how long should I do this for?
I'm glad to hear you're open to, at least trying this out. The recommended weekly amount of aerobic exercise is 150 minutes per week.
Whoa, that kind of sounds like a lot.
It does, doesn't it? But let's break it down a little bit. So if you exercise 5 days a week, that's only 30 minutes per day, right? So essentially, it'd be 7.5 cycles of the 3-to-1 walk run cycle we talked about earlier. How does that sound?
When you break it down like that, that does sound a little bit more manageable.
I'm glad to hear you think you can manage that. What are your thoughts as we talk about this?
Well, I definitely like the plan, but I'm a little concerned I may not have the motivation to go through with it.
Why is that? Tell me a little more about that.
I don't know. Just in the past, when I've tried to work out, it just never seems to stick.
Okay, so let's talk a little bit more about that. Can you think of strategies that might keep you motivated to stick with this new exercise plan?
Um, maybe if I had someone to help keep me motivated, that would help.
That's a great idea. Do you have anyone in mind?
Well, I have one friend that's really big into working out, and he's really into like the bodybuilding and stuff like that.
Okay, so do you think he might be able to support you even if you aren't into like bodybuilding like he is?
I think so. I mean, he has tried to get me to go to the gym in the past with him,
Really? Has that ever been something that you've been interested in doing?
I mean, I kind of have always wanted to gain muscle, but I don't really feel comfortable going into a gym and working out right now.
Why is that?
Uh, I just don't really feel confident enough at this point to go to a gym to work out.
Okay, that's fair. If you don't feel comfortable going to a gym quite yet, maybe we can revisit that in a few months. Eventually, we'll want to address that as it's also recommended that along with the 150 minutes of aerobic exercise, individuals have 2 days of strength training exercise per week. But for now, what do you think of the plan to just get you moving and running using that 3 to 1 walk run cycle that we talked about?
I like that.
Okay. So what do we need to do in order to ensure that you'll stay motivated and be successful with the plan?
Well, first thing I'm going to do is contact my buddy Johnny, and talk to him about my plan. I think he might be able to hold me accountable and might even be willing to join me on some of my runs. Like I said, he has been trying to get me to work out for years. So I think he'll be quite happy to hear that I am interested.
That's awesome. I think that's a great idea. Is there anything else that you might need in order to start this plan?
I don't have any workout gear, so I might need to get some equipment.
Okay, that's good that you were able to recognize that. So you definitely want to have proper footwear and clothing to prevent injury. Do you know what you need and where to get everything?
I figured I would just go to a store like Dick's Sporting Goods and see if they can help me out.
Okay, great idea. I would definitely recommend some shoes with lots of cushion, like Brooks, Saucony, Asics, etc., and trying them
Okay.
on in the store to see how they fit. You'll also want to invest in some running shorts and shirts if you don't already have some. Are you able to afford to get new shoes and equipment, or will that be a barrier to implementing this plan?
I think I should be able to afford the running shorts and shirt, but I'm a little worried about paying for new running shoes, as I know that those can be quite expensive.
You're right. Running shoes can actually be very expensive depending on which ones you get. However, it's important to invest in good running shoes to prevent knee, ankle, or foot injuries while running. Do you have any ideas on how we can potentially get you some quality shoes?
Well, my friend that I was telling you about, he's really big into the gym and has a ton of workout gear. And he's also a sponsored athlete. So I think he may have some coupon codes that I can use.
That's a great idea. But even with a coupon code, shoes can be expensive, right? So can we have a backup plan just in case, so that getting shoes doesn't remain a barrier?
Yeah, I think my buddy may even have a pair of running shoes that I can use until I can afford to buy my own. You know, he gets a bunch of free gear and barely wears a lot of it before getting newer stuff.
Awesome. It's a great idea, and I'm glad that you're able to identify an existing resource that you're able to use.
Thanks. You know, this is all really new to me, but I really do think my buddy will want to help me out with this.
Okay, so is there anything else about this plan that you have questions or concerns about?
I don't think so. You know, in all honesty, I'm kind of excited to get started. I feel like this might be the thing that makes me really commit to working out.
I'm so glad to hear that. Why don't I follow up with you in a week or so to see how everything has been going? It will provide you with another person to hold you accountable, and I can check in to make sure that you got your equipment purchased, contacted Jimmy, and have started exercising with your dog each night. How does that sound?
I think that would be really helpful. You know, I think it will keep me motivated to stick with the plan.
Great. So let's also plan for you to come back in so that we can monitor your weight and blood pressure. If we don't see any changes, we can either, modify this plan or potentially explore other options like medication. How about you come back in about 3 months or so?
That sounds good to me.
Awesome. Well, I'll walk you out and introduce you to Steph, our secretary, who will be able to schedule that next appointment for you. All right.
Cool. Thank you.
No worries. Thank you.